How are you?
How are you?
What can I do for you?
Well, I have some lines on my forehead and around the eyes that I do not appreciate, so what can be done about it?
You know, I mean, you are, how old are you?
43.
43. It's very common to have lines, transverse lines in the forehead, also here what we call the glabella and around the eyes. And what they are, we call them dynamic lines. The good thing is that we have something that works really well. And it's really the most common non-surgical procedure that we do as plastic surgeons really in the country. Well over 3 million injections of neuromodulators, and there are 3 right now: Botox, Dysport, and Xeomin. And the procedure is very simple, and you'll see that what I do is I just inject the muscles, or the hyperactive muscles as we call them, and it lessens their activity. It lasts for about 4 to 6 months. It's very technique dependent, very dose dependent. So obviously it's important to have it injected properly. It's very unlikely, for instance, to either have a droopy brow or a droopy eyelid, but theoretically it can happen, but routinely we don't see that. The key thing also with neuromodulators is that I want to give you a natural look. So I don't want to give you that sort of surprise look. And I'm sure you've seen that, and I have patients all day long coming in saying, just don't make me look like Mr. Spock, remember, or Dr. Spock, remember on Star Trek, where the eyebrow sort of goes up in a sort of V-shaped fashion. So we're not going to do that. It's going to be a very natural sort of rejuvenation, so to speak. The cool thing is that it really takes about 5 minutes to do it. You can resume full activity, makeup on right after, as you're walking out the door. You can put makeup on.
What, if any, are there side effects?
Well, this is a very safe product, and you can have a possibility of sort of flu-like syndromes, a headache. And we mentioned a little bit about the very unlikely possibility of drooping of the eyebrow or the eyelid. Again, those things really don't happen routinely. I do thousands of these injections each year.
Okay. When will I see the effects?
Whether you use the Botox or Dysport or Xeomin, the onset of action is pretty much the same, 2 to 3 days. And there's some variability from patient to patient, but 3 days is pretty safe. And hopefully you can enjoy this for about 4 to 6 months. Again, there's some variability from patient to patient, but it's very dose dependent, it's very technique dependent, but routinely it's 4 or 5 or up to 6 months.
Okay, great.